Welcome to the critical phase of our discussion on venous thromboembolism prevention. This is implementation and compliance of the policy. This section is a bridge between policy and practice, ensuring that our strategies for VTE prevention are not just theoretical but actively applied and monitored within our healthcare settings. Now let's talk about rules and responsibilities. Rules and responsibilities form the backbone of effective implementation. This policy delineates clear rules for everyone involved in patient care, from the VTE committee or task force to individual health care providers like physicians, nurses, and pharmacists. Each member of our team has a specific part to play, from conducting risk assessments to prescribing prophylaxis and educating patients. The role of VTE committee or task force. This committee oversees the entire VTE prevention program. They are responsible for providing quarterly reports, ensuring that the policy is up to date and consistent with both international standards and local needs. Their leadership is important in integrating VTE prevention into our organizational culture. Rules of medical and nursing staff. They play a direct role in patient care. Physicians are asked to perform initial risk assessments and prescribe appropriate prophylaxis. Nurses ensure that prophylaxis is administered correctly and that patients receive the necessary education to understand their treatment and potential signs of VTE. The pharmacist's role. Pharmacists have a unique role in reviewing prescribed prophylaxis for suitability and interacting with both the prescribing physician and the nursing staff to ensure optimal patient care. Their expertise in medication management is crucial for safe implementation of the pharmacological prophylaxis. Now let's talk about monitoring and auditing compliance. Monitoring and auditing are essential for ensuring that the policy is not only implemented but followed correctly. Regular audits help identify areas for improvement, ensuring that our practices align with the latest evidence and guidelines. This ongoing process supports a cycle of continuous improvement in patient care. Education and training. Education and training are key to successful implementation. Regular training sessions ensure that all staff members are up to date on the latest VTE prevention strategies and understand the rules within the policy. This includes understanding the use of mechanical prophylaxis devices and the administration of anticoagulants and the importance of patient education. Compliance is not just following rules, it's about creating a safe environment for our patients. By adhering to the VTE prevention policy, we can significantly reduce the incidence of VTE, improving patient outcomes, and demonstrating our commitment to excellence in healthcare. Thank you for joining us.